National CPR Day program, we, Department of Pediatrics, Dr. Vasantrao Pawar Medical College, Hospital and Research Center, along with Maha IIP and National IIP, will be conducting this today's event. I welcome Honorable Sir Chitnis, Maratha Vidya Prasarak Samaj, Advocate Nitinji Thakre sir. From National IIP, all stalwarts of IIP are joining online through various parts of India. So I welcome them all. National President IIP, Dr. Vasant Khadkar sir. President-elect, Dr. Neelam Mohan. Immediate past President, Dr. G.V. Basavaraj sir. Our educational officer, Dr. Vasantrao Pawar Medical College, Dr. Lokhande sir is shortly joining. Honorable Dean, Dr. Sudhir Bhamre sir. Then Secretary General National IIP, Dr. Yogesh Parikh sir. Treasurer National IIP, Dr. Atanu Badra sir. Superintendent, Dr. Vasantrao Pawar Medical College, Dr. Vasant Kamble sir. VP West Zone IIP, Dr. Ramesh sir. Joint Secretary Admin, Dr. Parmanand sir. Our Deputy MS, Dr. Vasantrao Pawar Medical College, Dr. Kalpana Madam and Dr. Mungesh Jadhav sir will be joining shortly. President Maha IIP, Dr. Sanjay Pakmode sir. Secretary General, Dr. Amol Pawar sir, I welcome you all. I also welcome Principal Physiotherapy College, Amrut Kaur Madam, Principal Nursing College, Purnima Naik Madam, Head of the Departments of various departments, all the faculties of today's program, and along with that, all postgraduate, undergraduate student, nursing student, physiotherapy students, welcome you all. Now, today is a CPR day, which we are celebrating. The theme is that everyone can save the life, and the family first. Train your family, train your friends that everyone can save the life. So let us all participate today in this learning session by taking the blessings of God. I request all the dignitaries on dais to proceed for lamp lighting.
इको होगी
I now request Dr. Ravindra Sonone sir, who is a PG coordinator, head of the Department of Pediatrics and Maha IIP treasurer, to talk about today's program. Ravindra Sonone sir.
A very good morning to all the dignitaries on the dais and of the dais. I welcome all present virtually and physically. I welcome our Honorable Sir Chitnis, Advocate Nitin Ji Thakre sir. I welcome National President Dr. Vasant Khadkar sir, President-elect Neelam Mohan Madam, immediate past President Dr. Basavaraja sir, then Dr. Atanu Badra, he is IIP, National IIP Treasurer. then Dr. Ramesh Bajania, West Zone President, then Dr. Parmanand, Joint Admin, then Maha-IP President Dr. Sanjay Pakmode, then Maha-IP Secretary Dr. Amol Pawar, and all the Dean Sir, Dr. Sudhir Bhambre Sir, MS Kaure Sir, then Deputy MS Mangesh Jadhav Sir, all HODs, Deputy MS Devne Madam, then all the UG students, PG students, nursing students, and physiotherapy students, and my Department of Pediatrics. So today we gathered to commemorate National IIP CPR Day, observed annually on July 21st by the Indian Academy of Pediatrics. This significant day honors the birth anniversary of Dr. Anand Shandlia, one of the dedicated BLS ALS instructor, and he was the national convener. And त्यांची आज actually जन्म तिथी होती. And serve as a powerful reminder of our collective responsibility to build a nation of lifesaver. Why this day matters? This National IIP CPR Day represents far more than ceremonial observance. It embodies a life-saving movement that transforms ordinary citizens into emergencies heroes. And the significance of this day is underscored by sobering statistic. Almost 90% of Indians don't know the CPR knowledge. 112 people experience cardiac arrest daily in India due to lifestyle factors. Only 40% of cardiac arrest victims receive bystanders, and immediate CPR can double or triple survival chances from sudden cardiac arrest. As a pediatrician and healthcare educator, we understand the knowledge without action remains powerless. Today's training program transforms this knowledge into the action. So, what is the critical time factor? Each minute CPR is delayed decreases survival odds by approximately 10%. In pediatric cases, prognosis for revival after cardiac arrest is significantly better than the adult. That's why we must ensure that every individual in our community, student, faculty, healthcare worker, possesses these vital skills. Now, so next to creating a life, the finest thing a man can do is to save one. This was a sentence quote by the Abraham Lincoln. There is no higher honor than to be given the responsibility to care for another human being. So take some time to learn first aid and CPR. It saves lives and it works. Be a lifesaver. Your hands can save lives, and all citizens in the world can save a life. CPR शिका, जीव वाचवा. वेळेवर दिलेली मदत वाचू शकते अनमोल जीवन. Each one can become a life saver. एक शिकेल, 10 शिकवेल. So as we conduct this today's training session in collaboration with National IAP and Maha IAP, we are not merely teaching a medical procedure, we are building community of potential heroes. Our National IAP ALS trainer will equip our UG students, PG students, physiotherapy students, and nursing students and skill that extends far beyond the hospital walls. Dr. Tarun Kanade, Dr. Abhijit, Dr. Amol Murkute, Dr. Rahul Kopikar, and Dr. Praveen Kale. These are the speakers. So we embark on this National IPCPR Day. Let us remember that we are not just not doing taking a knowledge, but that we are it is converting into the action. So we let us start now this journey to save the life of a precious human being. Thank you.
Thank you so much, sir, for your important view regarding this CPR day. Now I request National President Dr. Vasant Kalatkar, sir, to express his views. Vasant Kalatkar, sir, please.
Sir, please unmute, sir. Sir, please unmute, please. Yeah, sure.
Yeah. Now you are audible, sir. Please start.
So, good morning, everyone. Greetings from Central IIP, especially for this CPR day. Respected Dr. Neelam Mohan, who is our incoming president of Indian Academy of Pediatry. Then Dr. Uh, Basavaraja, our past president. Today's guest and who is the Karta Dharta of today's program from Vasantrao Patil Medical College, Dr. Thakre. Dr. Thakre. Then our national secretary, Dr. Yogesh Parekh, Dr. Atanu Bhadra, who is the national treasurer, Dr. Ravindra Sonone, Dr. Amol Pawar, secretary Maha-IP, Dr. Sanjay Pakmode, president Maha-IP, and all my colleagues. Today is a day in IIP that which we celebrate, that BLS CPR training, and that is CPR day in the memory of our beloved Dr. Anand Shandilya, who had taken a lot of effort for this thing. Basic aim that's CPR. We all know that essential life-saving skills as it's a cardiopulmonary resuscitation. A life-saving skill is a critical emergency procedure used when a child breathing or heartbeat has stopped. The lifestyle technique involve a combination of chest compression and rescue breath, aimed at manually maintaining blood and oxygen flow to vital organs until advanced medical help arrives or normal heart function is restored. Who can perform CPR? CPR can be administered by anyone who has received proper training and certificate, including healthcare professionals such as doctors, nurses, paramedics, and emergency medical technicians. Additionally, many laypersons, including parents, caregivers, teachers, and members of the general public, can effectively perform CPR if they have received appropriate training. And that's why this year we are having so many trainings of CPR through IAP. The one of the next program will be at Mysore, that to be along with the Maharaja of Mysore Palace, that will be in the campus of Maharaja campus, and that will be on 7th of August. Mysore IAP is going to train 2,500 people, more than that, number will be more. And for your information, I'm telling you, this year we are arranging a mega CPR camp through IAP, that training program in Nagpur. We want to train more than 30,000 persons on in that single day. That we want to make IAP visible through this program to community, and we हमको हमारा जो लेना देना लगता है community के लिए, that we want to give the for the community. That is the thing of from our program IAP के बाद community के साथ. या प्रोग्राम मध्ये बेसिकली आम्हाला सगळ्या लोकांना ट्रेन करायचं जेवढे बेस्ट पॉसिबल असेल, वेदर इट्स अ ड्रायव्हर, वेदर इट्स अ स्विगी ड्रायव्हर, वेदर इट्स अ टॅक्सी ड्रायव्हर, आणि शाळेतली मुलं जी की 8वी नंतरची 9वी नंतरची मुलं, दोज हू कॅन अंडरस्टँड सीपीआर आणि विच इज अ बेसिक लाईफ सपोर्ट, तर ते आम्हाला शिकवायचं आहे. अँड दॅट वी वॉन्ट टू डू दिस इयर. दिस इज अवर एम. When to perform CPR? CPR should be initiated immediately in the event of cardiac arrest or when a child breathing or heartbeat has stopped. Prompt action is crucial for maximizing the chances of survival and minimizing the risk of brain damage. The initial 4 minutes are vital for brain function, and every minute of delay decreases the chances of survival by 17%. Steps of CPR, you all know. I will not tell because next person is going to read. So this CAB, which stands for compression, airway, and breathing, here is simplified mnemonic for the general public. DRS, cab driver. D for danger. Ensure the scene is safe. Responsiveness. Tap the shoulder and ask, "Are you okay?" Shout for help. Activate the emergency response system and call an ambulance, that dial 108. Check pulse and breathing for 10 seconds. Chest compression, perform 30 chest swallows. These are all steps. So, when you are confirm that you are okay, and you can ask the emergency services. So, whenever you perform CPR, you should be well trained, you should be certified. That's why this is our thing. I thank you, Dr. Ravindra Sonone and Vasantrao Pawar Medical College staff for initiating this activity today on the mega scale. I wish, thank you once again, thank you for the director and team, official team of Vasantrao Medical College, those who are going to teach our people about the CPR. Thank you once again. I wish all the best for this program. Thank you. Jai Hind, Jai Hai.
Thank you, Dr. Vasant Palatkar, sir, for your wonderful message. Now I request Honorable Sir Chitnis, sir, Honorable Sir Chitnis Nitinji Thakre, sir, to guide us.
Good morning to one and all. We are here for a National CPR Day. And on the dais, Dr. Sudhir Bhambre, Dr. Kaude, Dr. Ravindra Sonone, all the HODs and faculty members, the students of post-graduation and undergraduate MBBS course, also nursing students and physiotherapy students. This is a very good initiative taken by our college and the forum which has organized this program. As rightly stated by the national president, that this is a very important activity because not only the doctors or paramedical persons can do this activity, even a lay person can also do this with a proper training. So this is very important. We have to impart the training throughout the all over the masses, the students, the cab drivers, every person who knows this procedure can save the life of millions of people. So this is a very scientific training which you should take this training, and after taking this training you will be able to handle the situation which is in the emergency cases. And as rightly stated that it should be administered as early as possible because the ratio of survival is very high if it is given in a proper time. So I wish all the best for this program. Many speakers are going to teach you how to perform this activity. And so I wish all the best to this program. Thank you. Thank you very much.
Thank you, Honorable Sir Chitnis, Dr. Nitinji Thakre, sir. You are always giving inspiration and motivation for us. Thank you so much for your blessings and support, sir. Now I request President-elect Dr. Neelam Mohan, Madam, to say a few words about this. Neelam Mohan, Madam, please. Neelam, Madam, please.
Neelam ma'am.
Madam lost the connection.
Okay, she will rejoin. Also,
Yogesh bhai can talk. Yogesh bhai.
Can we proceed
Baswaraja.
further?
can we ask next person, Baswaraja sir? Yes.
Yeah, Dr. Baswaraja, sir.
Yes, Basavaraj, sir, please.
Yeah, thank you very much, madam. Respected our national president, Dr. Vasant Kalatkar ji, president-elect Dr. Neelam Mohan ji, Nitin ji, Thakre ji, and all the on the dais and off the dais. Really, the Department of Pediatrics of Vasantrao Pawar Medical College. In fact, I visited this college as an examiner. There is an excellent academic atmosphere. Team led by Dr. Ravinder Sonavane, Department of Pediatrics, which is doing a great job under the guidance of Nitinji Thakre, and of course all the hospital administration. So they've taken a very good initiative to conduct this awareness program, which has been ably supported by our Central IAP team led by Dr. Vasant Kalatkarji, very dynamic Secretary General of Indian Academy of Pediatrics, Professor Yogesh Parikh himself is in a teaching faculty, and of course Dr. Atanu Badra, our National Treasurer. They are always supportive of all the activities which has been conducted by these state and city branches. Maha AP, which is always leading from the front for last 7 to 8 years, they are doing a great job with the under the leadership of the Sanjay Pakmode and of course Amul Pawar, with a great support from our Joint Secretary Admin. He himself is our pediatric intensivist, and Dr. Ramesh Bajaneji, Senior Vice President. They are all doing a great work in the West Zone with the other executive board member. So all these things is possible mainly because of groundwork from the Maha-AP people like Tarun Kanade, who was a young intensivist, Dr. Amul Murkute, Praveen Kale, Abhijit, Rahul, and many of the people who has been supporting all the work. Really, it is an applaudable that requires a big ground of applause to all these young Turk who is doing a great job. Just to recall one of the incidents, what recently which has been occurred in the, Bengaluru, you all know that when the Royal Challengers Bengaluru has won the match, after that celebration was taking place in a Chinnaswamy Stadium, more than 10 lives we lost it. During that time, even if the few people knew about in CPR, we could have been saved some more lives there. That is what the feedback we got it from the ground. So what I'm trying to say is CPR is the need of the hour, creating awareness and training in a general public. Of course, we are all doing a great job in terms of training our postgraduate, training our medicos. We are doing that great job. But can the IAP can look into behind the training of these people into the paramedical and of course the very needy public and drivers. This is where the Indian Academy of Pediatrics can make a big contribution. So in that way, Mahayap is taken a big initiative. Best wishes for the today's program. That witness has been by our Samir ji, Dr. Singaru Velu, Dr. Jitendra Gavane, all of them who have been, and Devendra Sarin, all of them are future leaders who has been doing in a great work to supporting these things. Best wishes for the today's program.
Thank you, Basavaraj sir, for your inspirational talk. Now I request Honorable Dean Dr. Sudhir Bhamre sir to express his views. Please, sir.
Good morning, everybody. The respected dais with our own Sir Chitnis Maratha Vidya Prasarak Samaj Nitin Raoji Thakre sir, our medical superintendent Dr. Kaude, pediatrics HOD our Ravindra Sonone sir, all the president of the IAP and all the office bearers of IAP and the people who have joined online for this session. Then our students, nursing students, MBBS students, PG students, those who are there present for this event. Then there are various speakers, pediatricians in the city from the city of the Nasik are there. They are going to guide everybody for the this training of the CPR. I think I just want to, in brief, tell you, sir, this is our 110 years old institution, Paratha Vidya Prasarak Samaj, and we have around 2 lakhs of the student strength in the whole district. And in the view of Kumbh Mela coming in the doorsteps, like this is going to be a very good activity, and we thank IIB for giving us this opportunity. This will be very helpful during even Kumbh and day-to-day life also. The few lives saved with this training are going to benefit the mankind. And I thank for IIP for giving this opportunity to our medical college. And everybody who is getting trained today will be benefited and will help or train the people around them. And this initiative is very important, and I wish all my best to this, and thank you so much.
Thank you so much, sir. You are always giving inspiration and your support is big task for us to complete the work. Now we'll proceed for the felicitation. I request respected Dean Dr. Sudhir Bhamre sir to felicitate Honorable Sir Chitnis Nitinji Thakre sir. Our request PG Coordinator, Head of the Department of Pediatrics, Dr. Ravindra Sonone sir, to felicitate our Dean, Dr. Sudhir Bhamre sir. I again request Sonone sir to felicitate our MS, Dr. Vasanta Kaude sir. Neela ma'am, you have joined now.
Yes, yes, he is there. Yes.
We'll just do a e-felicitation. Our National President, Dr. Vasant Kalatkar sir, Ravindra Sonone sir is doing e-felicitation for you. We will be sending the books.
Thank you. Thank you.
So we are feliciting by this method, new method. So these are the books. So we are feliciting first National President Dr. Vasant Kalatkar sir, then President elect Neelam Mohan madam, and immediate past President Basavaraja sir, and also Dr. Sanjay Pakmode sir, and Dr. Amol Pawar, Maha-IP Secretary. Thank you.
Yogesh Parikh sir, Atanu
And
sir,
Yogesh Parikh sir and Atanu Badra sir.
Parmanand sir, Ramesh Bajani
Parmanand
sir.
sir, Bajania sir. Yes,
Thank
sir.
you. Thank you.
Thank you so much. Neelam ma'am, you want to talk, please, sir? Please.
Yeah, just wanted to say a few words. Respected Vasanji, Baswaraja, Yogesh Parekh, Atanu, and the Senior Vice President Ramesh Bajania, along with Sanjay Pakmode and Mol, who have been in the organizing committee from Central IP and MAIP, would like to congratulate Ravindra and the entire team from the Institute for the stupendous work that they have taken. Few basic facts about India is that 70% of the cardiac arrest happen at home and less than 10, it is said to be 2 to 8 in different studies. They perform CPR during emergencies, and every minute delay decreases the response rate by 10%. Not only that, the bystanders who are standing when a person falls, in India it is 2%, whereas in the developed country it is 20 to 45% that the bystanders take part. And when the bystanders take role, it improves by double to triple. So I think, like they say, do sans zindagi ke, the meaning of 30 is to 2 needs to be totally emphasized again and again, because I'm sure there may be a lot of, besides doctors, we need to emphasize the public, the allied, as highlighted by the previous people. And it's a great work, and wishing you all great success in that. And I congratulate the entire OBEBs who have joined on this, along with the Nasik in Maharashtra state, for the great work that is being done. And Parmanand is always there to look after the work in the Maharashtra. Best wishes to all of you.
Thank you, Neelam ma'am, for your wonderful inspirational talk. Now I request Atanu Badra, National Treasurer, to speak few words.
First, Dr. Yogesh Parikh. Please wait.
Yogesh Parikh,
Please
sir,
wait.
please.
Yeah, thank you, Amol and the team for inviting us for this very important occasion of the National Basic Life Support and the CPR Day on the 21st July. As our president mentioned, we are celebrating or we are observing this very important day in the memory of our late Dr. Anand Sandile sir, who is served throughout his life for these ALS and BLS activities and given them a message to all our pediatricians to save lives of our country's national. So Central IEP already informed all the branches, city branches and the state branches to observe this very important day with the theme of the CPR saves a life and the slogan learn CPR, save a life, be a lifesaver today. So if we can save one life and in our whole of the life, then it will matter because the saving one life save the one family and the one important member in the society and the national level. So I thank you, Mahaepi, and specifically Dean and the Management Trustee of the Vasantrao Pawar Medical College and the Research Institute for celebrating and observing this very important program and training the physiotherapists, medical students, nursing students, and they will create awareness among the society and they may save in future one life. So it will be very important for us also. And those are experts, Dr. Tarun, Dr. Amal Murkute, Dr. Praveen Kale, Dr. Abhijit, Dr. Rahul Kopika, and our own Dr. Parmanand Anandkar, all are doing the excellent work in this field. And our ALS BS team of our Dr. Alok and whole team group of the ALS BLS also celebrating and observing this important day. And our president already mentioned we are going to create a Greenwich World Records in the Nagpur by the 30,000 members training on the CPR day. So thank you very much for inviting us. Keep doing excellent work. Dr. Sanjay Pakwadiji, Dr. Amol, and Dr. Ravindraji, and whole team of the Nasik, IIP, MahaIP, and supporting our own Central IIP this important day. Thank you very much.
Thank you, Yogesh Parekh, sir. Dr. Atanu Badra, sir, please.
Yeah. I think Maharashtra IIP deserves a special accolade for initiating this celebration today all across the country. Dr. Sanjay Pakmode sir and Dr. Amol Pawar sir, at the whole team, Dr. Parmanand, but at the same time it was expected because the the inspiration of ALS, BLS, Dr. Anand Shandilya was from Maharashtra, though he was a national figure. I was fortunate or unfortunate, so to say, to be in contact with him for his last 3 days of life, because he was supposed to come to my place for presenting an oration on 3rd of January, but we lost him. So I still remember the last words. Yes, I'll sit with long legs and a vegetarian breakfast. A very simple person who dedicated his life to IAP and ALS BLS. And really, it's a remembrance day. I think that Samir has put a message there. Yes, we all remember the Anand Chandili, and the first oration was in West Bengal because that was his last scheduled program that he was supposed to come. Dr. Ravindra Sonawane and his team is doing a great work. I think the Vasantrao Pawar Medical College was on the Maharashtra map, but today onwards it will be on the national map for doing this program. Thank you, everyone. Thank you. We are all there, joined at this difficult time just to inspire all of you for the whole day program. Thank you.
Thank you so much, sir, for your kind words. Now I request VP West Zone IIP Dr. Ramesh Bajania, sir, to speak few words.
Good morning, everyone. First of all, let me congratulate Team Mahai for the flurry of academic activities. And as has been said by Basel sir, one simple CPR, if someone has learned, then it can save a life. So my congratulations for doing series of activities. The department heavily assisted by Amol Pawar sir, Dr. Ravi Parmane sir, Parade sir, Amol Bhutta sir, Praveen Kale, Vijit Sangre sir, Rahul Kopika sir, for doing so many useful activities for the community. And we are really proud to work with the sir. He has not only taken care of academics, but environment his community activities. And let us wish that we all continue for the rest of the other companies. Thank you so much for this support.
Thank you, sir. Joint Secretary Dr. Parmanand, sir. Dr. Parmanand, sir.
Permanent, sir.
help you today? Hello. Good morning. Respected Kratkar sir, President, elect Madam, able to hear?
Yes, sir.
Madam.
Yes, sir. Please go ahead.
And respected Secretary sir and Atanu sir, and I congratulate the MAIP team led by Sanjay Pakmode and Amol to conduct such an important program on the occasion of Dr. Anand Chandelia's birth. We are fortunate, all of us who have been working in an LSPLS, we are fortunate been taught by Anand Chandelia sir, and how passionate he was for the CPR, and we can't forget him, and we all remember him from the heart. And the only thing when we have say about the CAB or what are the sequence, the chest compression, the airway and breathing, for mass awareness, it's only the chest compression. So what we try to save is that I can give everyone the chest compression that can also save the life. I have a personal experience of doing a CPR while in a marathon run, and with a good, the impact of it was it came out without neurological the damage. So I personally feel that the one who learns the CPR can save a child or save a person with a good intact the neurological outcome. And looking at all the instructors who are there to teach today, I know all the students are going to get benefited. I have worked with all of them, and I wish all the best to the new team and the MAIP for conducting such a program. Thank you.
Thank you, Parmanand sir. President MAIP Dr. Sanjay Pakmode sir, please.
नमस्कार. आजचा अतिशय महत्वाचा दिवस आहे. नॅशनल CPR डे. डॉक्टर आनंद शांडिल्य सारख्या जे बऱ्याच लोकांचे मेंटर होते, त्यांच्या जयंतीनिमित्त त्या प्रोग्रामला नाव दिलेले आहे. हा डे नॅशनल CPR डे त्यांच्या नावानंतर आपण आज सेलिब्रेट करतो. मंचावर उपस्थित असलेले सर्वप्रथम ऑनलाईन असलेले आमचे नॅशनल प्रेसिडेंट रिस्पेक्टेड डॉक्टर वसंत खलतकर सर, HSG डॉक्टर योगेश पारिक सर, ट्रेझरर नॅशनल CIP ट्रेझरर नॅशनल डॉक्टर अतानु बद्रा सर, आणि प्रेसिडेंट इलेक्ट मॅडम नीलम मोहन, आणि डॉक्टर परमानंद जॉईंट सेक्रेटरी, आणि MAIPचे डायनॅमिक सेक्रेटरी डॉक्टर अमोल पवार, आणि आजच्या कार्यक्रमाचे कर्तेधरचे डॉक्टर रवींद्र सोनोने. आणि ते सोबत आज आमच्या MAIPचे ट्रेझरर पण आहेत, बरेच ऍक्टिव्ह आहेत. आणि आजच्या या महत्वाच्या दिवशी त्यांनी स्वतःच्या मेडिकल कॉलेजला हा जो प्रोग्राम अरेंज केलेला आहे, हायब्रिड प्रोग्राम. सो MAIP आणि नॅशनल IP सोबत हा बराच म्हणजे व्याख्यानाजोगा आहे. आणि खरंच आजच्या त्या काय ऍक्टिव्हिटीमुळं हे MAIPचं नाव म्हणजे नॅशनल लेवलवर, इव्हन कॉलेजचं नाव जसं बसवराज सरांनी सांगितले, नॅशनल लेवलवर घेण्यात येईल. बाकी डॉक्टर ठाकरेजी जे सरचिटणीस आहेत, डीन सर, सुपरिंटेंडेंट सर, ऑल द HODs ऑफ वसंतराव पवार मेडिकल कॉलेज, आणि टीचर्स, आणि जे काही स्टुडंट्स जिथे उपस्थित आहेत ऑडिटोरियममध्ये, सर्वांना MAIP तर्फे मी स्वागत करतोय, आभार मानतोय. आणि आज अतिशय उत्तम असा प्रोग्राम वसंतराव पवार मेडिकल कॉलेजनी नॅशनल IP सोबत घेतलेला आहे. सर्वांनी सांगितलं की CPR डेचं महत्व काय आहे. लर्न CPR, सेव्ह अ लाईफ, बी अ लाईफ सेव्हर टुडे. आजचा हा प्रोग्राम म्हणजे चाकोरीला बाजूला ठेवून की नुसते डॉक्टरांनाच माहिती नसेल, तर सोबत त्यांच्यासोबत असणाऱ्या नर्सिंग स्टाफ, पॅरामेडिकल स्टाफ आणि इतरही स्टाफला हा प्रोग्राम म्हणजे CPR माहीत असलं पाहिजे. कारण CPR हे फक्त डॉक्टरचं काम नव्हे. या चाकोरीच्या बाहेर निघून आपण सुद्धा आपल्यापैकी कोणाला काही प्रॉब्लेम झालास आणि आपला ड्रायव्हर आपल्या बाजूला असेल, तर त्या ड्रायव्हरला सुद्धा माहित असलं पाहिजे की CPR कसं करता येईल, तरच तो आपला जीव वाचवू शकतो. तो अतिशय महत्वाचा असा प्रोग्राम आहे आणि महत्वाचा असा मेसेज आहे. आणि सांगितल्याप्रमाणे आता येणाऱ्या कुंभात नाशिकला जे होणारे कुंभ आहे, जसं बँगलोरला स्टॅम्पिड झालं की सर म्हणले की बरेच जीव वाचू शकले असते सर, जर बऱ्याच लोकांना CPR माहिती असतं. त्याचप्रमाणे आता येणाऱ्या नाशिकला कुंभमेळ्यात सुद्धा हा CPR प्रत्येकांना आणि माहिती असला पाहिजे, सो दॅट जिथे जिथे मोठ्या गॅदरिंग्स होतात त्या ठिकाणी आपण हा CPR माहीत असेल तर बऱ्याच जीवांना वाचवू शकतो आणि मृत्यू टाळू शकतो. आणि थोडाही वेळ केला तर काय फरक पडू शकतो हे प्रत्येकाने आपल्याला सांगितलंच आहे. हा प्रोग्राम अरेंज केल्याबद्दल मी वसंतराव पवार मेडिकल कॉलेजचं खरंच आभार मानतोय. त्यातल्या त्यात डॉक्टर रवींद्र सोनवणे आमचे ट्रेझरर आहेत, HOD पेडियाट्रिक्स, त्यांचं विशेष आभार मानतो. आणि सोबत जेवढे ट्रस्टीज आहेत त्यांनी परमिट केला हा प्रोग्राम करायला त्यांचाही आभार मानतोय. आणि आजचे जे स्पीकर्स आहेत डॉक्टर तरुण कानडे, अमोल मुरकुटे, प्रवीण काळे, अभिजित सांगळे आणि राहुल कोपीकर यांना माझ्या महाआयपी तर्फे शुभेच्छा देतो. आणि असंच हा प्रोग्राम पुढे चालत राहावा आणि 10 म्हणजे एकापासून 10 पासून 100 पासून तसंच आमचे प्रेसिडेंट डॉक्टर खळदकर यांचा हे आहे की नागपुरात येणाऱ्या 2-3 महिन्यात गिनीज वर्ल्ड बुक ऑफ रेकॉर्ड करायचं CPR एकाच वेळी 30,000 लोकांना CPR देऊन. आणि तो आम्ही त्याच्यासाठी बरंच प्रयत्न करतोय, बऱ्याच मीटिंग चालू आहे आणि आम्ही ते करू असं आम्ही ठरवलंय. मी एवढं बोलून आपल्या सर्वांना शुभेच्छा देऊन माझ्या वाणीला आराम देतो. थँक्यू.
थँक्यू संजय पाकमोडे सर. महाआयपी सेक्रेटरी डॉक्टर अमोल पवार सर, प्लीज.
Yes, thank you. Respected Mr. Nitinji Thakre sir, Sudhir Bhambre sir, National President Dr. Our Vasant sir, then Neelam ma'am, Basavaraja sir, Yogesh Parikh sir, Atanu sir, Ramesh Bajania sir, Parmanand sir, Sanjay, President Maharashtra IP Sanjay Pakmode sir, all the other attendees from entire India, Dr. Samir Dalwai sir, Dr. Devendra Sarin sir, Dr. Jitendra Gavani sir, I can see Dr. Singarvelu sir, and many others, and all the physical attendees at the auditorium of Maratha Vidya Prasarak Samaj College in Nasik. So this has been very great initiative. We were just discussing, Dr. Ravi sir and myself, and we thought that we'll do at national level, we'll do physically, we'll do hybrid, online plus physical. So there are many attendees online also, and the beneficiaries are all the medical college students, then nursing students, then physiotherapy students. So I wish all the best to all the delegates, happy learning, and also our young team, my all dear friends and colleagues from Nasik, Dr. Tarun, Dr. Amol, Dr. Abhijit, Dr. Praveen, and Dr. Rahul Kopikar, along with Deepa ma'am, Nilima ma'am, Sagar Sonone sir, and entire team, entire faculty staff of this pediatric department of NDOP College, Vasantrao Power Medical College. So they all are doing great job and doing various academic, social activities whole round a year. So wish you all the best. Happy learning to everyone. Thank you.
Thank you, Amol Pawar sir. Now I welcome Nasik IIP President Dr. Sagar Bhalerao sir and request him to speak a few words about it.
Good morning, everyone. All respected dignitaries online and offline. Today CPR Day चा एक आपला उद्देश जो होता की every person in this country should know the CPR because life saves it saves the lives. The first half hour जो महत्वाचा असतो आणि बेसिक आहे त्याला फार काय टेक्निकली फार मेडिसिन लागतं असं काही नाही. फक्त एक टेक्निक समजणं गरजेचं आहे आणि ते करता आलं पाहिजे. त्याच्यामुळे आपल्या याच्यामध्ये आपण ह्या गोष्टी आपण स्कूल्स मधून पण चालू करायचा विचार करतो जेणेकरून एव्हरी सिटीजन म्हणजे आज तर नर्सिंग कॉलेज आहे म्हणजे नर्सिंग स्टुडंट्स आहे हे उद्या तुमच्या समोर पेशंट ICU मध्ये किंवा एखाद्या वॉर्डमध्ये पेशंट डिस्चार्ज असतो आणि कधी कोलॅप्स जातो आणि CPR दिल्यानंतर फर्स्ट हाफ आवर्स मध्ये जर चांगला गेल्यानंतर पेशंट कॅन हॅव नॉर्मल लाईफ. या गोष्टी आपण कॉन्सन्ट्रेट करतोय. मी हे 2 शब्द बोलून मी थँक्यू म्हणतो.
Once again, thank you so much, all the national faculties. Now the inauguration part and felicitation part is over. That's what I declare. And now we are starting with actual CPR training program. So I hand over mic to Dr. Avanti Paraspe, who is a senior resident from our department. She will coordinate the next program. Avanti, please.
Good morning, everyone. I call upon stage our first speaker, Dr. Tarun Kanade sir, who is a well-known pediatrician and pediatric intensivist. He will be guiding us about the basics of CPR in adult and adolescents. Welcome, sir.
Good morning, everyone.
Good morning.
Good morning, everyone.
Good morning.
Yeah. So now the program starts and now the real training will start. I'm not going to tell you about what is CPR because everybody has been telling you what it is. We will start by, first of all, understanding whom to give CPR. Okay. So what is the full form of CPR, anyone? Someone from the last row? Cardiopulmonary resuscitation. Okay, so there are, you know, basically two organ systems which we are going to target. That is the heart and the brain and the lungs. Why not the brain? Why not the kidney? Why not the liver? Why not the eyes? Why only the heart and the lungs? Why only the heart and lungs? Why not the, I want the brain to revive. I want the liver to work. Why the heart and the lungs? So basically, these are two important organs because of which every other organ functions. So if you even have the brain working, but if the heart is not pumping blood, it is not going to reach the brain. So unless your blood is pumping and it has oxygen in it, no other system is going to work. Okay. So first of all, you have to recognize whom to give CPR. Okay. This day is, I cannot start without paying tribute to my teacher of teachers, Dr. Anand Shandilya. He was a gem of a person. One can never find a person as witty, as spontaneous, and as sharp as he was. It was a pleasure to learn from him. It was he who selected us as instructors, and it was his eyes which really saw through us and made us what we are today. So, heartfelt tribute to our sir. So CPR is performed as an emergency life-saving procedure. This emergency will never tell you that it's going to come. So it can happen anywhere. It can happen in your wards. It can happen in the hospital, in the corridor, on the bus station, in your house, in the street. So what happens when you see someone collapsing? What happens when you see someone unconscious? सगळ्यात पहिले आपण काय करतो? काय करतो आपण सहसा? तुम्हाला कोणी दिसलं, कोणतरी कोलॅप्स होताना पडताना दिसतं तुम्हाला एअरपोर्टवरती. तुम्ही काय कराल सर्वात पहिले? फर्स्ट एड म्हणजे काय करायचं? फर्स्ट एड बॉक्स शोधायचा पहिले. मग हेल्प अरे वाचवा, अरे कोई गिर गया, देखो देखो. मोबाईल काढून सरळ व्हिडिओ काढायचा. आजकाल सर्वात पहिले सगळे लोक तेच करतात. काही झालं जगामध्ये, पाऊस पडला, पाणी पडलं, खड्डा आला का कोणी मेलं, सर्वात पहिले आपण व्हिडिओ काढतो, है की नाही? पण आजपासून आपण हे नाही करणार आहे. आजपासून आपण काहीतरी नवीन गोष्ट करणार आहे जेणेकरून त्याचा जीव वाचू शकतो आणि त्याचा जीव वाचल्यामुळे तुम्हाला काहीतरी पुण्य लाभू शकतं. आपल्याला काही चांगलं वाटू शकतं. आपण आतापर्यंत दिवसभरात किती वेळा अशा गोष्टी करतो ज्याच्याने आपल्याला चांगलं वाटतं. आपण बऱ्याच वेळा सकाळी उठल्यानंतर आईला चांगलं वाटावं म्हणून लवकर उठतो, वडिलांना चांगलं वाटावं म्हणून कॉलेजला जातो, टीचरला चांगलं वाटावं म्हणून अभ्यास करतो, मित्रमैत्रिणी चांगलं वाटावं म्हणून आपण त्यांची छान छान बोलतो. पण स्वतःसाठी आपण कधी काही चांगलं करतो का? तर ही एक स्किल आहे जेणेकरून तुम्हाला स्वतःला काही चांगलं वाटेल भावी आयुष्यामध्ये. त्यावेळेस इट विल मेक यू वर्थ डुईंग दॅट थिंग. It will make your life worthwhile. It will give you joy. And whatever which makes you joyful will make you feel better, will make your mental health better as compared to what you were. Okay? So it involves basically, coming back to CPR, it involves basically chest compressions and giving rescue breaths. Only two techniques. काही हायफाय नाहीये, खूप काय आपल्याला गॅजेट्स वापरायचे नाहीये, खूप काय एकदम भारी सायन्स वापरतो आपण आणि असं काही नाहीये. बट इट हॅज टू बी डन इन अ स्ट्रक्चर्ड वे. मला असं वाटतं की मी पहिले हे केलं पाहिजे आणि तुम्हाला असं वाटतं तुम्ही तुमचं करा तुमच्या घरी, तुमच्या गल्लीत तुम्ही राजा व्हा, असं नाही. जगाच्या पाठीवर तुम्ही कुठे जरी गेलात तरी हीच टेक्निक, हेच स्किल्स आपल्याला फॉलो करायचे. ओके. So it basically involves chest compression. You have to keep the heart working and pumping and give with or without rescue breaths so that the oxygenated blood is circulated to the vital organs, especially the heart, the brain, the lungs, the kidneys. They will continue survival till you find the cause for it or till advanced health care is available. Okay. So who needs CPR? Any person who's suffering from a sudden cardiac arrest. Okay. Now cardiac arrest can occur in anywhere. Usually the terminal event is cardiac arrest. So भरपूर जर स्ट्रोक जरी असेल किंवा किडनी फेलियर जरी असेल किंवा लिव्हर फेलियर जरी असेल किंवा ट्रॉमा जरी असेल तर द टर्मिनल इव्हेंट इज कार्डियक अरेस्ट. सो वी विल स्टार्ट फ्रॉम देअर वेअर एव्हरीथिंग स्टॉप्स. Okay, so the heart pumping stops, the respiration stops. So there we are going to start. Okay. So in adults, most common cause is cardiac. Okay, there can be some rhythm abnormalities, there can be sudden cardiac arrest, there can be MI. So various causes, but it will lead to primary cardiac arrest. Whereas as compared to pediatrics, it is usually respiratory. There is some respiratory infection, bronchiolitis, foreign body, something causing obstruction. So that leads to hypoxia and that leads to cardiac arrest. So there are two major differences between adult and cardiac and children. That is, in adults it is mainly cardiac, whereas in pediatric it is mainly respiratory. So a victim of cardiac arrest has the best chance of recovery if the CPR is administered by a trained professional immediately on recognition of cardiac arrest. So first step in CPR is recognition of cardiac arrest. So we have to recognize this patient is suffering from cardiac arrest. This we have seen that majority of the cardiac arrest occurs at home. Witness is 85%, 95% who experience sudden cardiac arrest die because they don't get timely intervention. As sir said, Bhamre sir said that Kumbh Mela yeto ahe. Not only we don't have to wait for Kumbh Mela, okay. We see on the roadside, on your bus station, on your way home. Paramanand sir just mentioned he was running a marathon, and in that marathon he saw a person collapsing in front of him, and he could give him CPR, and that person survived. Dr. Jitendra Gavane sir is there who witnessed a cardiac arrest in air, mid-air, and he rescued that person inside the plane. Okay, he could survive, and they made an emergency landing, and the person survived. So all these things do happen in front of you, and you don't know when it will happen. Every minute is important. Everybody of our senior faculties mentioned that every minute is important after cardiac arrest. So each minute decreases, if you don't give CPR, decreases the survival rate by 17%. So how to recognize a cardiac arrest? First of all, you have to go, if you see someone collapsing in front of you or a person who's already lying in front of you, just tap him and see whether he is responsive or not, whether he's conscious or not. So how do you do that? You tap on the shoulder, or for an adult or for a child, you tap on the feet and just see, are you okay? Are you okay? If he's unconscious and unresponsive, you recognize that there's some major thing is happening in him. So before you start your steps, what you have to do, you have to call for help, because you're not Superman, you're not Iron Man, you're not Hulk or whatever it is. Okay, you are a simple human being, but you require help. Okay, so always call for help. आपल्याकडचा नंबर कुठला आहे? सर्वात महत्त्वाचा नंबर आपण जेव्हा whenever we call for medical help, 108, 108. Okay, so you call 108, or you have any local hospital number or a local ambulance number, call for help. त्यांना सांगा या लोकेशनला हे पेशंट अरेस्ट मध्ये आहे. I am starting CPR, please send help. Okay. If he has no, you check for his breathing, you check for his heart, for his pulse in the carotid area. All the things will be demonstrated to you. If there is no pulse, or it is irregular pulse or a very slow pulse, and there is no respiration, you immediately start the steps of CPR, cardiopulmonary resuscitation. You don't wait. मी याला फोन करून विचारतो, मित्राला बोलवतो, हे खरंच असं आहे का? मग बाजूला विचारतो, काय रे क्या लग रहा? असं काही करायचं नाही. तुम्हाला जर रेस्पिरेशन नाही भेटलं, पल्स नाही भेटली, यू स्टार्ट CPR. इट इज अ लाईफ सेव्हिंग मेजर. नो पोलीस, no law will stop you from doing it. Okay, and you continue CPR till some advanced healthcare arrives, or some advanced person takes over, or the child or the person becomes revived. Okay, so till that time you have to go. Now the next steps will be discussed by my colleagues. I ask you and I implore you to please go through them, learn those skills, practice those skills. And whenever you go in the community, try to teach them to some other person, at least in your house, so that someone in your house or in your relatives, if they collapse, they should get timely CPR. Okay, thank you so much.
Thank you, sir, for the wonderful session. As we all know, kids are not miniature form of adults. They have a complete different physiology. So let's learn about the basics of CPR pertaining to children. For this, I call upon stage Dr. Amol Murkute, sir, who is the director of Safali Hospital, West Zone IAP, ALS and BLS instructor and pediatric intensivist. Welcome, sir.
Thank you. At the outset, I would like to pay homage to Dr. Anand Chandilya. There is no ALS, BLS or CPR activity in India without remembering him. And also, I would like to thank Central IIP, all the office bearers, Maha IIP, all the office bearers, and the staff and dignitaries of Vasantrao Power Medical College for giving us this opportunity. So coming to the steps of CPR, the very first step is to ensure your own safety. And before helping the child or the victim of cardiac arrest, you should help yourself by taking that particular person out of that danger scenario. नाही तर तुम्हाला CPR द्यायची वेळ होईल, असं नको व्हायला, है ना?
you should remove the victim from swimming pool or a fire incident and then start assessing. Next thing is to do check for response. For bigger children, adolescents and adults, we tap on shoulder and ask, are you okay? Hey, hello, are you okay? And for kids, we just tickle their soles and say, baby, baby. If the child is awake, he or she will respond. Next important thing, as Dr. Tarun sir has already told, shout for help, because you alone will get fatigued after say 10, 20, 50 minutes of CPR. You will definitely need help. And studies have shown that administering CPR along with shock is having a wonderful outcome. So you will need automatic external defibrillator, AED, which we commonly see in malls and airports. That is also there. That is why you need someone to bring AED, and also in real life Indian scenario, you need some medical personnel or ambulance for your help. Next thing to do is to check for pulse and breathing. So for pulse, we check carotid pulse for adults and adolescents, and pediatric, I'll come to it. And while checking pulse, just tilt your neck and see whether the victim is breathing or not. The approach is look, listen and feel. You look for chest movement. You listen for air movement. The gushing of air in and out will give a sound. And you feel the air, warm air coming out of nose or mouth, that you will feel. So by that way, you can ascertain whether the victim is breathing or not, in addition to check pulse. So there are three possibilities. Pulse is present, breathing is also present. Will he need CPR? Pulse is also present, breathing is also present. लागेल का CPR? नाही. मग काय करायचं? Just turn the victim into recovery position. Just turn the victim into recovery position and keep observing the child. Wait till the help arrives. Another possibility is that pulse is present but breathing is not there. In that way, in that case, you will have to give rescue breathing. How can you give rescue breathing? Either mouth to mouth, or if you have a ambu bag or anything like that with you, you can provide positive pressure ventilation with ambu bag. And third scenario is there is no breathing, no pulse. In that case, you will start CPR. Another important thing from today onwards, whenever you find any victim of cardiac arrest, where there is no pulse or breathing, you will not do CPR from today onwards. You will do high quality CPR. आजपासनं फक्त CPR नाही करायचंय. काय करायचंय? हाय क्वालिटी CPR करायचंय. ठीक आहे? So the recovery position which I was telling you, turn the victim into recovery position if there is breathing and pulse both. Rescue breathing if only breathing is absent, and start high quality CPR if there is cardiac arrest scenario. So what is high quality CPR? First, the victim has to be on the flat, firm surface. You will have to kneel above the victim's heart, and heel of your hand, after locking your hands, heel part should be in the lower half of sternum, just below the nipple line. And you will have to give firm pressure, and it has to be push hard and push fast, at least 1 to 1.5 inch deep inside you should go, and you should call it loudly the number. So cycle has to be 30:2 for adults and adolescents and 15:2 for children. Okay? Push hard, push fast, at least 1 to 1.5 inch. 100 to 120 times you will have to push every minute in a smooth fashion. You should allow complete chest recoil. You should not lift your hands off the patient's chest. Keep it on the chest, but allow chest to recoil completely. How will it help? Heart has to get filled, no? Then only it will pump the blood. So by allowing recoil, you are allowing the heart to get filled by blood again. Then minimize the interruptions. This is high quality CPR. And AED is automated external defibrillator. It has you just have to stick the leads, just one below the right clavicle and another in left axilla, and it will prompt you what to do. That instruction you will have to just follow. And whenever AED has given shock or not advised shock, you will immediately have to resume CPR. Now for mouth to mouth breathing, just like giving mouth to mouth, which we see in movies, will not work. Opening the airway is also very important. That is, the maneuver is called head tilt and chin lift. So head tilt is done by one hand. You press the forehead. That is, by that case, the head tilts and you lift the chin. By lifting the chin, the fallen tongue comes anteriorly and the airway gets opened. While doing CPR, no rocking movement, no bouncing on the chest, no bending, no double crossing. Both the hands should be interlocked. No massaging. We are doing chest compression, not chest massage. And don't be a sitter. You will have to do CPR actively. So for bystanders and non-medicos, it is the thing which is advised nowadays is only hands only CPR, where only chest compression only is advised, COLS, compression only life support. So in that case, laymen have been trained to just do chest compression, no rescue breathing. But for us, medical personnel, we should learn the complete cycle of the complete flow chart or the steps of VLS. Till what time should we do the CPR? Till the help arrives. Okay. Now, children, it is little difficult. How will you identify whether the victim is child or adult? ते तर कॉमन सेन्स आहे ना, बघितलं कळेल बच्चू आहे का मोठा माणूस. ठीक आहे. बट how will you differentiate whether this person is adult or adolescent or pre-adolescent age? If any underarm hair on the child's chest or underarm axilla, it is considered as sign of puberty, and that will go into the flowchart of adult and adolescents. Or any breast development in females, they will go into the flowchart of adolescent and adults. So for that case, the ratio is 30:2, 30 compressions and 2 rescue breaths. If nothing of that sort is there, you will move on to the flowchart of kids, where the ratio is 15:2. As Tarun sir has told, the commonest cause of cardiopulmonary arrest in children is hypoxia. So by decreasing the ratio to 15:2, in addition to chest compression, you are giving importance to rescue breathing also. Thereby, the breaths are coming relatively frequently, as against 30:2, which is there in adults and adolescents. Okay, and it is difficult to palpate carotid in pediatric population, so we prefer brachial or femoral pulse for pulse check. So for infants also, the ratio is 15:2, and we check brachial or femoral pulse. Instead of hands interlocked, we can either use 2-finger technique because chest is very soft, or you can encircle your hand around the child's chest and do chest compression with your thumbs. Okay, this is the key difference as far as ALS, BLS in adults, adolescents and pediatric population is concerned. Just to revise the same steps, first step is scene safety. Remove the victim to a safer area. Then check for responsiveness by tapping on shoulder or ticking on soles. If you feel the victim is unresponsive, first thing to do is call for help. Okay. Then you do pulse check and breathing check simultaneously. For adults, adolescents, you prefer carotid. And for children and infants, you do brachial or femoral. 3 scenarios: no pulse, no breathing, high quality CPR. Pulse is present, breathing is absent, rescue breathing, mouth to mouth, head tilt, chin lift. Pulse is also present, breathing is also present. Turn the victim into recovery position and wait for help. The ratio for adults and adolescent is 30:2. The ratio for infants and children is 15:2. The site of chest compression is lower half of sternum, just below the nipple line. the pressure has to be given by both hands, movement, like the pressure is from heel of the hand, no hand crossing. For infants, either 2-finger technique or both hand encircling the chest. Okay. And you will have to keep on doing cycles till the help arrives, or when the AED arrives, you will have to attach the AED, wait for the instructions from the AED and proceed accordingly. Once the AED clears that the shock is advised or not advised, you will have to resume CPR immediately after the instruction. Just remember the steps and the ratio. Now, for important part of removal of foreign body, I call upon next speaker, Dr. Praveen Kade.
Hello. Good afternoon, everyone. Yeah. If you don't give response, we have an excellent CPR trainer. If you don't give any response, they will start CPR immediately. Okay. So our first rule, if there is no response, no pulse, start CPR, right? So that's the basic. So I am going to explain how to proceed for choking or if there is any foreign body aspiration, right? So it's very common. You can have the victims, either they are adults, children or infant, right? So most commonly it happens when they are feeding or we are taking something solid food, it gets stuck in our airways and it causes choking, right? So choking are of two types, right? So either there will be a mild choking or severe choking, right? And in case of mild choking, म्हणजे काय थोडंसं आपल्या श्वासनलिकेत पाणी गेलं किंवा अन्नाचा एखादा तुकडा जरी गेला तरी वी फील लाईक अ choking, right? So in that case, you will be breathing, right? There will be mild wheezing. You can speak the word or you will cough, right? This is a mild choking. And in case of severe choking, airway get completely obstructed and there will be, you cannot speak. So there will be no words. You're just being struggling to take a breath. Okay. And you cannot cough. You cannot talk. So this is the symptoms of severe choking, right? So in this case, you have to do emergency maneuver to relieve the choking. So in case of adult, so there will be a universal choking sign, right? If you get choked, you will just put your hands around your neck. So this is called as a universal choking sign. So first is you recognize the choking. You recognize whether it is a mild choking or severe choking. If it's mild, you just stay with the victim, allow him to cough and monitor the victim, called emergency response team, because mild choking can get converted to severe choking, right? If it is severe, then you ask the person, are you choking? And you take a immediate action. So in adults and children's, what we perform is abdominal thrust. We called it as a Helmick maneuver, right? So in this maneuver, you just stand behind the victim and place your arm around the victim's chest or abdomen, right? Make a fist and place it just above the navel. So you have to just make this fist and place it above the navel and grasp this fist by another hand. Okay. And you have to give a thrust upward and backward up to chest until foreign body is expelled. काय होऊ शकतं? दोनच गोष्टी होऊ शकतात. एक तर foreign body will come out or the victim become unresponsive, right? If it become unresponsive, then what we have to do? You have to immediately start cardiopulmonary resuscitation, right? So only step different is when you are giving rescue breath, you just see whether you can see the foreign body in the airway or mouth. If you can see the foreign body, just swipe your finger and try to pull out the foreign body. But if you don't see the foreign body, don't do blind sweeping of the fingers, right? Okay. So this is in case of adult and children's. So next we go to how to remove a foreign body from choking victim, mainly infant. So infant will not speak, hai, they will just there will be a very harsh sound. They will be struggling to breathe, and if this there is severe choking, there will be a cyanosis. So in infant, we do a maneuver which is called as abdominal blows and back thrust, right? So in this maneuver, you just place the infant in your hand, okay, support the airway by your fingers, okay, and just give back thrust by your another hand with the force upward and downward. The head and the airway of the infant should be facing downward, right? And then again, shift the infant on other hand supported on your thigh and just give abdominal thrust by pushing downward and towards the chest. So this is a simple maneuver which are going to explained and demonstrated by Dr. Rahul. Don't worry, I'm just covering the theory part.
Thank you, sir, for the wonderful session. We will proceed with the felicitation of the first three speakers. I request Dr. Gauri Diwan Madam to please felicitate Dr. Tarun Kanade, sir. Now I call upon Dr. Anup Bharti, sir, Professor and HOD of the Department of Psychiatry, to please felicitate Dr. Amol Mulute, sir. I request Dr. Deepa Joshi ma'am to please felicitate Dr. Praveen Kale, sir.
तरुण सर moment sorry.
We will continue with our next session. I call upon stage Dr. Abhijit Sangle, sir, pediatrician and pediatric intensivist, and also IAP ALS PLS instructor, who will be guiding us about child BLS demonstration and practice, adult BLS.
Good afternoon, everyone. Good afternoon. Or it is good morning. Okay. 5 minutes. Okay. So theory we have done. Okay. We have learned how to do CPR, when we have to give CPR. So some practical points. So I will need few volunteers also. Okay. So any volunteers, I will first demonstrate how to do, and then I will ask few volunteers to demonstrate. Okay. Hello. Am I audible? Yeah. Okay. What first thing we have to do? First three things what we have to do. When we see any scene where we found that somebody is unconscious, unresponsive, we assume that he might be in arrest. What three things we have to do first? Scene safety, somebody said. Okay, first thing, scene safety. Okay, we have to see, we should not become victim. Okay, so we have to see the scene safety.
Okay, so we have to take the victim to the place which is safe for victim also and for us also. Okay, then second step we have to do, call for help. Okay, then check for responsiveness. Okay, how we will respond? Check how we will check the responsiveness in adult. I am taking for adult. We have to tap on shoulder and ask, "Are you okay?" Or in the language, which local language. Okay, are you okay? So we have to tap. Are you okay? Are you okay? And see what response we are getting. If there is no response, then what we have to do? Check for the pulse. Which pulse we have to see? Okay. And then simultaneously what we have to do? Breathing. So where we check the pulse, carotid, where it is? To locate the carotid, simple thing we have to do. Keep the patient supine, locate the trachea and slide the fingers, your 2 or 3 fingers to the groove which is in between the trachea and the immediate muscle, sternocleidomastoid. On your side, not on the opposite side. Okay. So we'll slide it here. Okay. And simultaneously we see the breathing is there or not. For how long we have to do it? 5 seconds, not more than 10 seconds. Okay. 5 to 10 seconds. If there is no palpable pulse during this time, you have to start the CPR. Okay. So in adult, we have to see the carotid. And once we have seen the carotid, there is no pulse. What will do the start CPR? How will start the CPR? Yeah. First thing, we have to locate the position. Where is the position? We have to give the chest compression. It is imaginary line joining the two nipples just below that or lower half of the breastbone or sternum. Okay, you have to first put the hand or heel of the hand firmly, and with the second hand we have to hold the first hand and cross the finger. Come in the position. Your hand should be straight. Elbow should not be flexed. Your shoulder should be on the hand. Okay. And we have to start the CPR. What CPR we are going to give? High quality CPR. What are the components of high quality CPR? 4 components. Push hard, push fast. Okay. Push hard means the depth should be at least 5 centimeter, not more than 6 centimeter. Push fast means we have to use the compression 100 to 120 compressions in 1 minute. Okay. Second thing is allow chest recoil. Okay. Why we have to allow the chest recoil? So that the blood can come in the heart and it will go in the body next cycle. Third thing, minimal interruptions. Okay. So I will just demonstrate. We have located and we have started the compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29. Then we have to do 2 breaths. Because in adult we have to maintain the ratio of 30:2. So we have to give the 2 breaths. During that, what we have to do? We have to use the maneuver head tilt, chin lift. For head tilt, we have to put the palm on the forehead, push it backward with your fingers on the mandible. You have to lift the jaw so that the airway should be open and the tongue should come forward so that it should not obstruct. Simultaneously, we have to pinch the nose and then give 2 breaths. Okay, and continue this. Till what time we have to do it? Till help arise or the advanced CPR team comes. Okay. Any volunteer which can come and do. One more people. So in adult, even if it is 1 rescuer or 2 rescuer, we have to do 30:2 compression ratio and breathe. Okay. Okay. So start. So you come for the lecture and you saw that suddenly your friend is unconscious, what you will do?
First, we will check the surrounding. First, we will check the surrounding if there is a firm surface and if we are safe.
Scene safety you will do.
Yes.
Then
We will check responsiveness. So we will tap on the shoulder and ask if he is able to respond. Are you okay?
are you?
Then if there is no response, then we will check for pulse. We will check carotid pulse.
One thing we have to see whether there is any etiological object like drugs, poisons or something is there, then you can be ready with the antidote if required.
And we will also call for
help. Or if the person is there, she will go and call for the emergency activate service and bring the aid.
Then we will check for carotid pulse. So, on the side to trachea and between trachea and sternocleidomastoid, we will check only 5 to 10 times. 10 seconds we will check. And we will check for breathing.
Breathing. You have to go at the level. You have to look, listen, and feel. There is no. So there is a 3 scenario. As Murphy sir has shown that there are 3 scenarios possible. What? You will get the first thing. The person is breathing and pulse is good. That time what you will do? Recovery position. Huh? Second thing, the person is not breathing well, but pulse is there. What will you do? You rescue breathing. Okay. And third is no pulse, no breathing. CPR. So start CPR. How will you do?
Just below the nipple lies. One heel of the hand.
Yeah, start. So is it high quality CPR and effective? Why?
No.
Depth is not there and you can take. At the same time, you have to count so that if the person is ready for the help, that person will give the breath after the 30.
Don't bend your elbows. Elbows lock. Movement in the spine. Movement of spine only. Correct. Say it loudly.
So you can feel that there is a effort. We have to get the more power and then only we will be able to do it. So as sir has notified that there are few things we have to avoid. What we have to avoid? We have to avoid the bending of the elbow. It should be straight. Second, we don't have to do the jerky movement. Okay. You don't have to do the bouncing. Okay. Third thing, what we don't have to do? No rocking kind of movement. It should be steady. Okay. There should not be no detachment. Okay. Bouncing should not be there. Okay. There is no massaging or over crossing. Okay. You want to try?
I'm starting on only competition.
Yeah, only competition. Because we have to take the.
Count, count.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 29, 30.
If see her height is small, but whenever you are going to do that time, if you can lower the bed or you can climb on the bed so that you will be on the whole thing should be the idea. She was doing that time, she was inclined. Okay. The shoulder should come in the line. Okay. And then only effective compression will get. Okay. And it should not be like compression will be smooth and release will be fast. It should be equal. The compression and release time should be equal. Okay. We'll move forward for the next. Thank you.
Okay, so now we have learned about adults and adolescents. Now we move to children and infants. Quick revision from lecture. What is a child? Above 1 year, but before puberty. What is puberty? Underarm hair in males or breast development in females. If this is not there, this is a child. Okay, what is infant? Below 1 year. Correct. Now, steps of CPR in infants and children are similar. In a child, the technique of chest compression is also similar. Okay. Only thing that changes is the ratio. So, infant and children have what ratio? 15:2. So now for demonstration purpose, we will demonstrate for infant. Okay, because for child almost everything is similar, but for infants the techniques are very different. Okay, so now you all have to help me revive this child. Okay, I have come to this scene where there is a child lying. What is my first step? Scene safety. I have to see where this child is. If child is in the middle of the road and I want to now give CPR, you will have to give 2 CPRs after this. Okay, so first thing is the scene safe? Second step, maybe child is only sleeping, no? So what to check? Is the child responsive? So baby, or are you okay in adults, right? So after you check for responsiveness, suppose the child is unresponsive. Now what? Child is not responsive. What to do? Call for help. So call 108, or in our hospital, what do? We call code blue. No? We call on the phone and say, call for help, get an AED, and tell them your location also. Okay, you've called for help. Now what do you do next? Third step? Check for the pulse and check for breathing. Now, as sir said, you look, listen and feel. So when you're doing look, listen and feel, try to turn in such a way that you can look at the chest, you can feel the airway, airflow in your ears, and you will listen for whether there is any sound of breathing. And when you're doing that, you're going to check pulse. Now, in infant, where do you check pulse? Brachial. Okay, so for infant, remember brachial. Keep it simple. How to check for brachial pulse? So if you feel the point between shoulder and elbow in the middle, on the medial side, you slide your fingers on the medial side and try to feel for the pulse. How long to feel for pulse? More than 5 seconds, but less than 10 seconds. Okay, so in no way you should wait for more than 10 seconds. Till 10 seconds, if you are still searching, can't feel anything, assume no pulse. Okay, so more than 5 seconds, but less than 10 seconds. Now, suppose there is no breathing and there is no pulse. What will we give? What did sir say? Not CPR. What do we give? High quality CPR. What are the steps of high quality CPR? Push hard, push fast. Now, what is the technique in an infant? This is where it is important. If I am alone, I want to give breaths also, I want to give compressions also, correct? So the technique to use is the 2-finger technique. What is 2-finger technique? You find the same point, just like sir said for the adult. Imaginary line between the 2 nipples in the midline, just below that. Keep your fingers. Now, how you are keeping your elbows straight? You have to keep your fingers straight and you have to give compressions. What is the depth of this compression? 1 to 1. In this case, it will be 4 centimeters. More than 4 centimeters. That is more than 1/3 of the AP diameter. Okay. Now, important thing when you are giving this compression is your left hand is free. No. What to do with this left hand? Yeah, you can keep the airway open. For an infant, there are so many advantages. Your left hand is free. Keep the airway open. Use your 2 fingers and give compressions. 1, 2, what ratio? 50. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then? 2 breaths. 2 breaths. How do you give breaths? Ambu bag. For adults, how do you give breaths? Kuch nahi, I don't have ambu bag, I don't have mask. Mouth to mouth. Now, this is infant, you know. In an infant, the mouth and nose are so close, you have to cover both. Okay, so you give mouth to mouth and nose, remember. So head tilt, chin lift, and you give mouth to mouth and nose. How many breaths? 2 breaths. Okay, so this you will continue 15:2 till your help arrives. Once your help arrives, there will be a small change in what you do. Because you have help now, one person can totally focus on breathing and one person can give compressions. And a more effective method with 2 rescuers is to give the 2-thumb technique. Okay, so sir described, no, in the slides, there are 2 methods. 2-finger and 2 thumbs. So we will prefer when you have 2 rescuers to have 2-finger technique. Now, how do you give 2-finger technique? Infants are small. You can actually lift them, no, like this. Don't lift them when they are unresponsive, but I'm just showing you.
Put your fingers behind the chest wall. Put your thumbs in front, same point where you were giving two finger technique. And you can compress them in the midline like this. 1, 2, 3, 4, 5, 6 in this position. Okay. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And your second rescuer will then give breaths. Okay, from the other side. So only change now when you have two rescuers is same ratio. 15:2, but now you will be giving it with the two thumb technique. Okay, because that is better. How long to continue?
Help.
When advanced help arrives or the child revives. Okay, very simple. Anybody would like to volunteer? This is easier than adult. You won't have to get tired. Height is not a problem. Very, very easy to give in an infant. Okay, any two volunteers. Boys. Some boys, correct. Only girls will come. Two boys. Somebody from MBBS now. I think nursing has come already, no? Physiotherapy has done, no? Sorry. The nurses can come. Come. Aja, either I'll pick or you'll come. Aja, good. Anybody else? One more. I'll pick or you'll decide. You have reached the scene. You have reached the scene where very good. You have reached the scene where you find that this infant is collapsed. How do you start?
First, I will look for the scene.
You will look for the scene safely. Very good.
And then I will.
Scene is safe.
Yeah, scene is safe.
Okay.
And then I will check for response.
Check. How will you check? How? Can give a little tap, please.
Tap the feet.
And say baby or bala, whatever you want to say. How will you call a child?
Baby. And then after that, I will check for pulse.
Before that, what did you find when you tapped the feet?
It's not responding.
Not response. Now what to do?
I check for pulse.
Before that, you need some help, no? He's waiting.
Yeah. So I will call for help.
What will you tell him? Get some help. Get an AED. Okay, and tell him where you are. He knows where you are. So he will do the rest. Okay, next step.
Check for pulse.
How do you check? Show everybody how you check the pulse.
Between the shoulder and the hand.
Between the shoulder and elbow.
Elbow. Over here, we'll check for the pulse.
Very good. Yes. How long you'll check?
5 to 10 seconds.
Anything else to check? While you're doing this, it need not be one after the other. Side by side.
You have to listen and please breathe.
Check for breathing also. Right. Okay, not breathing, no pulse. Now what to do?
Now I will start the CPR.
Very good. Okay, good. Start CPR. So he has found the imaginary nipple line. And just below that, in the midline, he has kept his two fingers. What to do with left hand? Just tilt the head. Yes, very good. He has tilted the head also. Start CPR. Was he pushing hard? No. Push hard.
And fast also.
And fast. How fast?
15.
100 to 120 per minute means almost every two compressions will come almost every second. Count.
6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Now, to give two breaths. Okay, so when he's giving breath, you have to lift the chin also. Okay, lift the chin and tilt the head. Head you have already tilted up. Now with this, you can lift the chin and now give two breaths. Okay. Just show that you're giving. How will you give? Correct. Two breaths. After this, yes. Let's go CPR. Correct. Now your help has come. Count loudly.
11, 12, 13, 14, 15.
Give your two breaths. Now you can help him. Now he's must be tired, no? Giving compressions. You have to summon him. Now you can come this side. He'll help you with compressions. Now two of you, no? Now what technique should you use? Two thumb technique. Can you see? Sorry. Sure. One, two. No, your fingers now can go behind. Yes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Breath there. Okay, so this is to rescue CPR. Clear? If anybody else wants to come and try, you can also come and try. Okay. Any doubts? Sure. Thank you. Good. Okay, so quick revision again, the steps last time. Scene safety, check for responsiveness, call for help, then check pulse and breathing, start CPR. Okay.
Hello. Hello. So before saying vote of thanks, we would like to felicitate our speakers by giving medal by the hands of our Dean Sir, Dr. Sudhir Bhambre Sir. So I invite Dean Sir and Dr. Amol Murkute. All speakers are national IAP, BLS, CRP trainers. They are certified trainers. So we were very lucky to take privilege of these all speakers. Now I invite Dr. Abhijit Sangre. अभिजित प्रवीण काळेंचं पण तूच घेऊन डॉक्टर प्रवीण काळे त्यांना जावं लागलं त्यांच्या ऐवजी आता अभिजित घेतोय डॉक्टर राहुल कोपीकर आयपी प्रेसिडेंट डॉक्टर सागर भालेराव एमओसी इतकं छान पद्धतीने इनॉग्रल फंक्शनचे केलं ते आपल्या असोसिएट प्रोफेसर डॉक्टर दीपा जोशी मॅडम आमच्या विद्यार्थी रेसिडेंट डॉक्टर अवंती ज्यांनी ऍक्च्युली हे आहे सीआरपीचं जे एमओसीस केली अवंती परांजपे 19 तारखेला आपण ऍक्च्युली हेच नॅशनल IAP BLS आणि CPR डे साठी आपण पोस्टर आणि स्लोगन कॉम्पिटिशन घेतलेली होती तर याच्यातले पोस्टरचे फर्स्ट प्राइज आहे श्रुती पाटील आणि दीपाली महाजन आहे काय ते श्रुती पाटील आणि दीपाली महाजन Three claps for them. Second prize goes to Pooja Divte and Gajanan Chotala. Gunjan Chotala. Gunjan, not Gajanan. Okay. चला त्या निमित्ताने हसले चांगली गोष्ट आहे Third prize goes to Neelam Devre and Tejal Thakre. Neelam Devre आणि Tejal Thakre. जवळजवळ पोस्टर आणि स्लोगन मिळून 40 जणांनी पार्टिसिपेट केलं होतं. त्याच्यातले पहिले 3 पोस्टरचे अवॉर्ड आपण अनाऊन्स केले. आता स्लोगनचं फर्स्ट प्राइज गोज टू काजल दराडे. Second prize goes to Samruddhi Bhadane. Third prize goes to Pratitnya Aire and Rutuja. Thank you, Dean sir. एक ग्रुप फोटो घेऊन टाकू सरांबरोबर. Yes. आप भी सगळे आले पाहिजे तिकडचे पण.
I now invite Dr. Pratiksha Madam from Department of Pediatrics, who will be giving the vote of thanks.
Good afternoon, everyone. On behalf of Department of Pediatric, Dr. VPMCHRC, in collaboration with Maha IAP and IAP, I take this opportunity to extend my heartfelt thanks to all those who made today's event CPR training program successful. First and foremost, our sincere gratitude goes to our chief guest this Advocate Nitin Thakre sir for his valuable time, inspiring presence and encouraging words. Also thanks to our Dean sir, Dr. Sudhir Bhamre sir, MS sir, Dr. Vasant Kaude sir, Dr. Kalpana Devune madam, Dr. Mangesh Jadhav for their continued support in organizing such educational and socially relevant initiative. Thanks to Team IIP, Dr. Vasant Khalatkar sir, National President, Dr. Neelam Mohan, President-elect, Dr. G.V. Baswarajan, immediate past President, Dr. Yogesh Parikh, General Secretary, Dr. Atanu Bhadra, Treasurer, Dr. Ramesh Bajania, VP West Zone, Dr. Parmananda, Joint Secretary. Though we could not all have your physical presence, but your virtual presence means a great deal to all of us. Also, thanks to Maha IIP team, Dr. Sanjay Pakmode, President, Dr. Amol Pawar, General Secretary, Dr. Ravindra Sonone, Treasurer. All of your engagement support made this event successful and meaningful. A special thanks to our expert faculty, Dr. Amol Murkute, Dr. Tarun Kanade, Dr. Abhijit Sangre, Dr. Rahul Kopikar, Dr. Praveen Kale, who explained and demonstrated the technique with such a clarity, patience, and dedication. We are also thankful to HODs of all department, UG coordinator, PG coordinator, principal of physiotherapy, Amrut Kaur madam, principal of nursing, Purnima madam, who took time out of their busy schedule to be with us.
And a big round of appreciation goes to all the participants and performers for their enthusiastic involvement and energy. I also extend a warm thanks to Dr. Ravindra Sonone, sir, HOD and Professor of Department of Pediatric, along with his team, whose hard work and meticulous planning ensures smooth conduct of today's event. To our technical team and backstage crew, thank you for making everything seamless. Let us all take today forward the message that every hand can save a life. Thank you.
Thank you all. Now you can go. Okay. Pallavi madam.
Yes, sir.
हाँ ठीक है तेच म्हटलं की